Okay, so we're at the top of the hour, so we'll get started. Good evening, everyone. Welcome to our Health's COVID-19 event about vaccinations. My name is Dr. Randy Robinson, and I am the Chief Medical Officer at Our Health. As you know, Our Health is a comprehensive primary care company that values our patients' relationships above all else. Today, our goal is to impart some knowledge and context with respect to the COVID-19 pandemic and more specifically, vaccines. The point of this information is to allow you to make an informed decision when choosing to get vaccinated. We are going to be delivering the most up-to-date, unbiased information, and this is going to be a little interactive as well. We will be taking some live polling of the group along the way, and then at the end, we will be happy to take questions. So the chat box is disabled, but there is a question and answer box for you to submit questions along the way. So it is now my pleasure to introduce my partners in crime in this task, Doctors Binita Prajapati and Dr. Jackie Slakoper. Dr. Prajapati practices in our West Orange, New Jersey location, and Dr. Slakoper practices in our Yardley, Pennsylvania office. Together, the three of us have made up the nucleus of our Health COVID task force for the better part of the last year. We have been addressing challenges and applying knowledge for decision-making in our practices in 4 states, as well as for dozens of companies across the country. I'd like to first allow Binita and Jackie to briefly introduce themselves, and then we'll go on from there.
Hi, everyone. My name is Dr. Binita Prajapati, and like Randy said, I am the Our Health family practice physician here in the West Orange location. I joined Our Health in July 2019 after leaving Bergen County for approximately 22 years in practice. I'm really passionate about preventative care, and I welcome the opportunity to meet some of you one day.
Binita,
Yes.
if I may ask if you have a headset. Yeah, you were just going in and out, or maybe it was just for me. But thanks, Binita. Jackie, please.
So I'm Dr. Jackie Slakoper, and as Dr. Robinson mentioned, I practice at the Our Health Yardley location in Pennsylvania. And I also joined Our Health in June of 2019, around the same time as Binita. And I practice full scope family practice. I see babies all the way up into the elderly. And I love preventative care, women's health, pediatrics, the whole gamut of family medicine. And I'm excited to share with you this evening a little bit about this very important vaccine and how it can really change the landscape of the COVID pandemic that we're in the middle
of. Thanks, Jackie. Thanks, Binita. We are absolutely privileged to have both of you with us here tonight. So I'd like to start off with a polling question. And are you planning on getting the COVID-19 vaccine? And your choices are yes, no, or unsure. So this really gets to the root of the fact that in America and really across the world, we have a lot of people making decisions based on what they perceive to be conflicting information. In diverse populations, particularly in Latino and African American communities, the acceptance of the vaccine is actually far lower than in other communities. And some of it has to do with misinformation, and quite honestly, some of it has to do with our own history. So this is interesting. Looks like a high vote for yes, and understandably, there's some hesitancy too, and that's okay. And we'll be addressing all of that. So our goal here today is to see if we can demystify some of what might be unknown to you about the COVID vaccine, and then to see at the end if this knowledge changes your decision. If you're unsure, does it help you become sure? If you are in the yes category, does it reinforce your decision? So, Binita.
Hi, everyone, again. I'm Binita Prajapati, and I wanted to say thank you so much for joining us tonight as we chat about COVID vaccine. So currently, right now in the United States, we have two vaccines, the Pfizer and Moderna vaccine. Both of these are mRNA vaccines that were issued by the FDA Emergency Use Authorization in December of 2020. They are both two shots given approximately 3 to 4 weeks apart. They're about 95% effective in preventing severe COVID disease. Now, with that being said, before we get into them, let's just talk briefly about the vaccines that are in the pipeline. So right now, there's two vaccines that are coming up, probably should be available to us in a month or so. That's the AstraZeneca and the Johnson & Johnson vaccine by Janssen Pharmaceuticals. These vaccines are called viral vector vaccines because they're comprised of an inactivated flu virus. So a cold virus, I'm sorry. So the AstraZeneca is a two-shot vaccine, and it has an effective rate for about first shot is 70% and the next one at 85% in preventing moderate to severe COVID infection. The Johnson & Johnson vaccine is a one-shot vaccine. So some of you may say, that's great. It's one and done, you're done, lots of ease in scheduling and administrating the vaccine, which is really good. The effective rate for the Johnson & Johnson, they're saying geographically varies from place to place, but overall is about 85% effective in severe COVID disease. However, I don't think maybe waiting for the vaccine might be the right thing. It might be best to get whatever is available as quickly as is available to all of us. So let's get back to those vaccines. The Pfizer vaccine is 30 micrograms that is placed intramuscularly in the deltoid area, if everybody can see, and it is given approximately 3 weeks apart, both shots together. Now, this Pfizer vaccine is approved for ages 16 and over. The Moderna vaccine is 100 micrograms per vaccine given in the outer deltoid area again, and there are two shots that are given 4 weeks apart. And the Moderna vaccine is approved for ages 18 and over. Now, the issue is because of the limited availability and distribution of the vaccines currently, we've had some scheduling issues with scheduling that second shot. So the CDC does state that we can get the second shot up to 6 weeks later, and it should be okay, although there's no clear studies to show anything after that 6-week period for now. The other thing they recommend is that if you started with Pfizer, stick to the Pfizer vaccine. And if you started with Moderna, stick to the Moderna. Try really hard not to mix and match if and when possible. And also when you get the vaccine, they will give you a white card. Definitely make sure you hold on to that card because it's going to serve as proof of vaccination down the road if and when you need it. Now, a little bit about what happens when you get the vaccine. You get the vaccine, what happens in your body? Your body develops what we prime that immune system. So it's just a fancy term for saying your body is now building antibodies. And the booster or the second vaccine really does boost that immune system so that you have antibodies that stay longer in your system. Because what happens is your immune system builds what we call memory cells. And these memory cells give you protection for a longer period of time. Now, honestly, I know you guys are all wondering, when is this vaccine going to be available to me or to my family? And these are really good questions. Unfortunately, because of that limited availability and due to the distribution, we've had a little bit of a bottleneck. But you know what? I think this is just something very temporary. And I think in the next few weeks, we will be seeing a ramp up in most places on both the state and local levels, and should be available to all of those that need it right away and to others down the road as well. So I think it's coming. It's just, we just have to be patient. And in the meantime, we have to remember
just continue to socially distance and wear our masks and clean high-touch surface areas, and just really continue to do what we've all been doing. And I'm sure we'll get through this together. I'm going to now introduce to you my colleague, Dr. Jackie Slakoper, who is going to talk to you a little bit about the safety and efficacy of the vaccine.
Thank you very much, Dr. Prajapati. All right, so let's talk about the safety and efficacy of these two vaccines that we just went through. So current data is showing us that after 2 doses of the Moderna or the Pfizer vaccine, that they're about 94 to 95% effective at preventing COVID infections, including those severe COVID infections. So what does being fully vaccinated actually mean? So as with a lot of things that are surrounding the COVID virus, it's not yet known if individuals who are fully vaccinated can still transmit the virus, even if they do become infected and don't show symptoms. So this kind of goes back to what we've all been talking about, and we want to make sure that we're still doing our part after we get vaccinated and masking up, continuing to socially distance, and following good hand washing and sanitizing practices. What we do know is that with the vaccine, our protection is far greater and more robust at protecting us against severe COVID infections. We know that with the vaccine, it results in a more vigorous antibody response that lasts longer than what natural immunity would give us. So it's projected to be about 2+ years with the vaccine, as opposed to the varying 3 to 8 months that's projected right now with natural immunity coming from being infected with the COVID virus itself. So we all choose to get vaccinated for different reasons, but what's most important was that by getting vaccinated, we are helping to contribute to what's called herd immunity. So let's talk a little bit more detail about what herd immunity means and why we hear this term talked about so much when we discuss the vaccine. So herd immunity occurs when enough people become immune to a disease, making its spread unlikely. And as a result, the entire community is protected, including those that are not immune themselves. So herd immunity is usually achieved through vaccination, but it can also sometimes occur through natural infection. So some would argue that if we can achieve herd immunity through natural infection, then why do we need to rely on a vaccine? And the answer to this lies a little bit in the numbers on this slide. So if we take a look at the current scenario, and actually I think this is changed. It's changed since this. So this is about a little bit over a week ago, these numbers. So about a week ago, the scenario was 410,000 deaths out of 25 million cases. And now we're to 450,000 deaths in 27 million cases. So big jump, big change in the past week. So by protecting as many individuals as we can with herd immunity, we'll develop herd immunity over time, and without all the deaths and long-term illness and effects on society that uncontrolled disease spread has and will continue to lead to.
Jackie, I'm sorry to interrupt. I just also wanted to add that if you look at this slide and you look at if everyone gets vaccinated, the allergic response, right, of less than 300, it's actually, since this slide was initially developed in the last week or two, more data has been collected, and we actually find that it's about half that. So it's more deaths in the current scenario. And if everyone got vaccinated, it's actually about 150, 160 will have allergic reactions.
Yeah. So that's pretty significant, and kind of touches to that we're constantly learning more and more about, the vaccine and COVID, and why the vaccine is becoming very important in our fight against COVID.
Absolutely.
So going back to herd immunity, one thing that we think about, okay, what's that magic number that we need to reach in order to get herd immunity for COVID? And truthfully, we don't really know the exact number for this yet either, but we do know that percentages for herd immunity are higher the more contagious the disease is. So, for example, diseases like Ebola and influenza have a herd immunity requirement in the 50% range, whereas measles, which is highly contagious, has a herd immunity about 92 to 94%. It's projected that for COVID, herd immunity, that number probably lies somewhere between the two of these at about like 70 to 80%. And again, this can change as we, learn more and, mutations and all of those things that are going, that we're talking about. And so, but about 70 to 80% we want to see for herd immunity as of right now. So now that we've discussed the vaccines available and why vaccination is important, let's talk about the safety of these vaccines. And then Binita will go on to discuss the side effects that we've been seeing with the vaccines. So I know one concern that I've gotten asked about time and time again from both family, friends, and patients is about how quickly these vaccines were able to be approved. So let's take a second to talk about the whole FDA approval process for vaccines and how this process happened with the COVID vaccines. First, and most importantly, it was the bureaucratic red tape that was cut during this process, not the science itself. So normally a vaccine or a drug has to go through 3 separate phases before it's able to be approved. Phase 1, which is testing that a vaccine leads to an immune response, and phase 2, which looks at the safety of the vaccine, were actually combined for the COVID vaccine. So instead of going through 2 separate phases, they went through phase 1 and phase 2 together. So this cut a lot of time out. Then when the vaccines reached phase 3, which is when a vaccine is administered to thousands of individuals in randomized controlled studies looking at the effectiveness and additional safety data, and they do this by comparing those that have received the vaccine to those in a placebo group. This, at the same time, manufacturing of these vaccines began. So normally it's not financially advantageous to start mass manufacturing a vaccine while it's still going through phase 3. However, during a pandemic, things are a little bit different, and the financial support was there for the manufacturing. And also phase 3 was a little bit easier to start because there were a lot of subjects for phase 3 and finding them was relatively easy. So they still went through all the right phases. These vaccines went through everything that they were supposed to go through. They just condensed everything a little bit because they were able to speed things up. So another question I get surrounding vaccine safety is about patients with allergic reactions and serious health conditions, and if they should still get the vaccine. And the answer is yes. At this time, the only individuals who should not get the vaccine is anyone who has had an allergic reaction to one of the components in the vaccine itself. So one question that came up in an earlier discussion was, how do I know? How do I know if I'm allergic to one of those components of the vaccine? And this is a great question to talk to our health provider about. We'd all be happy to go through it with you. But most likely, if you don't know of any allergic reaction that you've ever had to a vaccine or a food or anything like that, then most likely you're not going to have an allergic reaction to one of the components of this vaccine. But at the end of the day, always ask questions. You can talk to any of our health providers about this, and we'd be happy to guide you through this. Our elderly, our frail, our immunocompromised are all recommended and encouraged to get this vaccine. And depending on the vaccine that we're currently talking about, the cutoff is age 16 or age 18. And this is only because they've yet to be studied in the younger age groups. So even if you've had an allergic reaction to another vaccine or have allergies to eggs or other allergens that are not in the COVID vaccine, you should get the vaccine. And something that's reassuring is that all of the distribution centers have been trained and equipped just in case there is that rare reaction. And additionally, centers are following all the procedures for observation periods following the vaccine. So you're going to find that you're going to have to wait there for 15 to 30 minutes, depending, so that you can be observed to make sure that everything is good after the vaccine. And now I'm going to turn it back over to Dr. Prajapati to talk about the side effect profile of these vaccines.
Thank you so much, Jackie. So one thing we've got to remember is that the COVID vaccine is not a live vaccine. Therefore, it cannot give you COVID infection. So when you get that first injection, and there might be a little bit of soreness at the site of the injection, might be a little red, might be a little swollen, there might be some fatigue or chills or a low-grade fever. These are nothing to be worried about. This is just your immune response at work. And don't worry if you don't even have those side effects. But in case you do, that's just your immune system responding. Now, the second vaccine I know is a little bit tougher because that's when your immune system is getting its booster. So therefore, you're going to end up with, some people end up with a fever, 101, 102. We've seen up to 103 in some patients. There's fatigue, there's joint pain, there's a little bit of body aches and nausea. All of these symptoms are temporary, lasting anywhere from 1 to 3 days, depending on the person. And it really is, self-limited. It goes away. But the one thing is it should not deter you from getting that vaccine. If anything, know that this is something temporary and it's for a better or a greater cause. Now, the other thing is to always try to remember to maybe we can try to plan for the second dose, because the second dose, if you know that, there might be a potential for these side effects, maybe meal prep planning or grocery shopping ahead of time so you don't have to get out for a day or two might be something worth looking into. Or if you are able to have the ability to work from home, if you leave the home, then that might be something to think about. Now, I just wanted to share with you my vaccine story. So I got my vaccine, I got the Pfizer vaccine, and I got it at a local hospital. Over there, everybody was practicing social distance and they were fully masked and gloved. And I got my first shot and was asked to wait the observatory 15 minutes. And I left and I went home. And I felt nothing. I was fine for about 6 hours. After 6 hours, I felt a little bit of soreness in my arm. But to be honest, that was just about it. Meaning the next day, maybe I felt that soreness persist for about 24 hours, but I never developed a fever, no body aches, no other constitutional symptoms like that. So the first shot was done. 3 weeks later, I went for my second vaccine. And once again, I went to the same hospital setting, and everybody once again appropriately masked and gloved and practicing social distancing. I took my second shot. I waited the 15 minutes and I went home. And I was completely fine till about, I would say, 12 to 16 hours after that second shot, when I started developing body aches. The body aches went into a fever, went into joint pain, went into some chills, and I developed a temperature of about 102, 102.6. So that lasted for about 24 to 36 hours. I took some Tylenol. I felt better. And I was back doing my thing again. So I was really happy that, I was done with it, and that now I know that I have got some immunity and some long-term immunity because of that vaccine. Jackie, would you like to share your story?
I definitely would. So my story is a little bit different than Binita's. I received my vaccinations in a pharmacy setting, and I had the Moderna vaccine. So both times when I went, I arrived at the pharmacy and I, had some paperwork to fill out. They had me answer a few questions about allergies and current medical conditions, those sort of things. I received my vaccine in a private setting, so a private area that was secluded from everyone else. It was just me and the administering pharmacist. And the pharmacist that was administering the vaccine was in full PPE, mask, shield, and gloves. The vaccine felt no different than any other intramuscular vaccine that I've received in the past. And I felt perfectly fine following the vaccine. I waited my 15 minutes for observation and then was able to continue about my day with both the first and the second dose. My first dose, all I experienced was similar to Binita. I had a sore arm for the following 2 days, but nothing more than I felt with, a flu shot in the past or a tetanus shot in the past. My second vaccine, I did have a nice immune response, which I oddly welcomed and was prepared for, because I knew it was a sign my body was building antibodies to help protect me in the future. But it's also really important to remember there's going to be individuals that don't get that much of an immune response, and that does not mean that your immune system is not working against the vaccine. So just because we had an immune response doesn't mean that you should, if you don't get one, it's not that the vaccine is not working for you. So my symptoms were chills that started about 12 hours post-vaccine, and then it developed into fever, some fatigue, headache, and body aches for the following 36 hours. And then after that, it all kind of went away, and I was able to, was back to my normal self. And all in all, it was worth it. And it definitely made it easier being able to be prepared for that possible response and planning my, 24 to 36 hours post-vaccine. I knew that, I might get a response. So I kind of arranged around that. So, all right, Dr. Robinson, would you like to share your story?
Sure. So I hear, that Dr. Prajapati had it at the hospital, Dr. Slakoper, had it at the pharmacy. I had my first injection at a public health clinic, and the public health clinic was staffed mostly with active duty infantrymen in fatigues. And I say that just to point out the vast differences that are out there. We're all sort of attacking this all together with as much as we can to throw at it, which is why the National Guard in a lot of areas is called up to help. I got my injection rather than the person who gave me the injection. In Dr. Slakoper's case, they were in the spacesuit. In my case, they had a mask, and that was it. Also in my case, at one point they put me into an area, and 45 minutes later, I sort of brought to people's attention that I was still waiting. They forgot about me. Again, I bring this up to say that this is new to everybody, and we just all have to be flexible. So I got the injection. It was Pfizer, and it was a punch in the arm. That's what it felt like. It didn't feel like that till the next day. It felt like that on that second day. And then that was it. I would say in a strange way, I said, well, I wanted to feel a little more. But again, like Dr. Slakoper said, I know, in the back of my mind that you don't need to have that response for it to be doing its work. But still, it's something nice to have. Okay, so I think it's time to go over some questions, some live polling. So let's ask a question. And we are waiting for a question to be brought up. So the polling question will be this. True or false? I will test positive for COVID-19 when I get the vaccine. And we'll wait a little bit, but I think if we were paying attention, the answer should have been there. And let's see what we've got. You will not test positive. So the answer is, so the right answer is false. What you will test positive for with the COVID vaccine is the antibody test. So the antibody test will allow you to test positive. So one way you can check to see if you've had an adequate response is several weeks after your second vaccination. You can get an antibody test and sort of verify that it's doing what it's supposed to be doing. So why don't we ask another question? And this question will be, here we go. True or false? The vaccine will make me sick with COVID-19. And Jackie, what do you say about that?
Well, I don't want to give the answer away, but
we'll see.
We'll see. See what everyone says. It's kind of similar to the one before. So.
Yep.
All right. Oh, 100%. I like it. All right. So you are all correct. It's false. So remember, the vaccine is not a live vaccine, and it will prompt your body to make the antibodies, not the virus. So again, as we all kind of shared with you, you might experience some flu-like symptoms for the 12 to 48 hours following the vaccine, but this is just a sign that your immune system is working. So good job, everybody.
Yep. All right. Dr. Prajapati, this one will be for you to wax philosophically on. I will need the vaccine if I've had COVID-19, true or false? So
let's wait for that answer. Don't want to give it away. And the answer is yay! Everybody, awesome. Everybody's paying great attention. This is fabulous. So yes, we know that COVID-19 has some long-term consequences, right? If you end up developing it. We've seen some patients with COVID-19 that post-COVID, they've had brain fog, lightheadedness, memory issues, fatigue, persistent loss of taste and smell, among other things. So, I think, and we also know that reinfection is possible with COVID, although we know that it's pretty uncommon. So I think, the natural immunity, we don't even also know how long the natural immunity from infection will last. So we do know that when we get the vaccine, it'll give us a booster and it'll give us protection that will last us longer to fight this infection. Now, the one thing we do have to keep in mind, though, is that COVID-19 patients who have received the monoclonal antibody treatment or the convalescent plasma, you should really, the recommendation from the CDC is to wait 90 days before getting the vaccine.
That's a great point. So let's have one final polling question. And this is, how long does the COVID-19 vaccine last? 3 months, 6 months, 1 year? We don't know.
Let's see if we can get another 100%. Close, almost. All right, so the answer is that we still do not know, and time will tell. So it's projected that we'll get immunity from the vaccine for about 2+ years. But that's opposed to, as Dr. Prajapati kind of touched on, we really don't know how long natural immunity is going to last. It's been projected between 3 and 8 months. But we do know that from the vaccine, we're going to get a more robust and longer immunity than we would with natural infection. So the answer is we don't know, and time's going to tell. Oh, all right. So I want to go into, and I saw that there was a question already in the question and answer kind of asking about this. So how can we help at Our Health? So all of our practices are currently in the process of applying for and waiting for approval from the state to obtain the COVID vaccinations. We know that vaccines are in short supply right now, and we're hoping that in the coming weeks and months that we see a little bit of a shift in this and that they're becoming a little bit more readily available. So we're all equipped and ready to go for when we do get vaccines in our offices. And once we have the supplies available, we'll be able to start vaccinating our members based on the state and county level guidelines where your Our Health practice is. So in the meantime, if you have any questions or concerns about the COVID vaccines, or if there's anything that we're not able to answer this evening and get to all the questions that we have, you're always encouraged to reach out to your Our Health provider for guidance and for answers. If you have any specific questions towards your health or how to get the vaccine or need a little bit of help tracking something down, we'd all be happy to help you. So reach out to us and we'd be all happy to help guide you in that.
Terrific. So I hope everyone has been learning a lot today, and I'd like to address another aspect about COVID vaccinations. There's another important reason why we should all try and get vaccinated when we can. And not everyone in our lives is going to be able to get vaccinated. Some will not have the right information. Some might be infirmed and be homebound. Others might not be able to get it for medical reasons, although that's a very small group. So since they are unable to get it, it's sort of incumbent on us to get it, to keep them safe as well. Let me also briefly mention the elephant in the room, which is people might be hedging about getting the vaccine because of the variants or the mutations that we've read about in the paper. I'll tell you that the mutations are actually slowly evolving. This is actually expected. And it happens over time with almost every virus. It's why each year the flu shot is made new because of the different strains and mutations in order to adequately attack the flu. So I fear that this is going to lead some people to say, you know, because of the mutations, why even try and get vaccinated? However, this is exactly the reverse of where we should be thinking. Because in order to slow the mutations, we have to take away its feeding source, and that's us. And also, just as importantly, all of the vaccines actually at this point are effective on the new variants, almost as effective. There might be some differences, but none of the vaccines that are available to us are wholly ineffective to these mutations and strains. So even when less effective at preventing the infection, they're all still greatly effective at preventing severe symptoms. So we're now going to take a few questions from the Q&A chat box, and then we'll follow up with one more polling question after that. So I am going to stop my video so no one sees me craning my neck to see these questions. And I am seeing a question about asking if I got the second shot, which the answer is not yet. So that's an easy question. I like it like that. What is the efficacy rate of the Pfizer Moderna vaccines? Melinda can wait.
So the Pfizer and Moderna effective rate is approximately 95% for preventing moderate to severe COVID infection. That's what the studies have shown so far.
So I see a question. Someone unfortunately tested positive, and they know that it's a very wide range. When should they consider getting the vaccine? Well, look, I would say this. It's what we know is that pretty much 3 months at a minimum. I will tell you from a safety mechanism, they have you wait 2 weeks from your diagnosis, not because of any interaction, but because they don't want you to potentially infect the healthcare community. So it's safe to go at any time clinically. However, waiting 3 months is great. Do you have to wait to let everyone get vaccinated in front of you? No, you absolutely don't. It's not our job as individuals to stop ourselves from coming in. As long as we're being truthful about what our health conditions are, it's up to the community that's delivering the vaccines to prioritize that. So you don't have to feel guilty if you've had COVID and you have overlapping immunity. That's great, but now go get the vaccine because it'll be better for you. And I think what we're also developing is information that's telling us probably in the near future that if we've had a COVID infection, we may only need one injection, but we'll see. We'll see. Early data is looking that way, but for now, we stick with the science, which says 2 and done. Will we be administering it at our locations? That was answered. Let's see. Will it be something that we'll need annually, like a flu shot? Dr. Prajapati.
So this is where we don't know yet. We don't know how long this immunity is going to last. We are hoping that, that some of the studies are showing that we possibly won't have to get immunized until for another couple of years, but it's really so hard to say right now, and only time will tell when we look at the clinical studies, the phase 4 studies to see.
That's great. So what is the best way to get scientific questions answered by our health provider? A virtual office visit or through the online communication system, Spruce? Dr. Slakoper.
I can take this one. So it varies from practice to practice and provider to provider. I know for my office, I love spruce and I love communicating through spruce. And if we want to get into more of a detailed conversation, then we schedule or we hop on a virtual visit to talk a little bit more. So I encourage all of you, if you have questions, don't be afraid to ask us. We might not know the answer right off the bat, and we might have to look into it a little bit, but we're all here to partner with you in your health, and we will definitely do due diligence to find the answers for you. But as you've seen, some of the answers we don't have right now. Some of them are, we're learning as we go. And, but yes, if you have specific questions, definitely reach out to your Our Health provider any way that you've reached out to them before. So through Spruce, give them a call, set up a virtual visit, whatever you're the most comfortable with.
Dr. Prajapati, after the vaccine, when are we immune?
So it depends. So after the first vaccine, the first shot, I would have to say everybody's saying the studies are saying somewhere around 10 days, we're going to start seeing those acute antibodies starting to form. And then after the second vaccine, they say you have pretty much good immunity after about 10 days after your second shot. So in which case you have two types of antibodies that are formed. First, from the first shot, those antibodies go on to become long-term antibodies. And then you have the acute antibodies that form from the second vaccine, which ultimately go on to become long-term antibodies. So I'm sorry for the long response, but it's full immunity will be 10 days after your second vaccine. And even after that, we still want to maintain and remind everyone the importance of still wearing a mask and still socially distancing and still washing the hands frequently, because we still have to protect those around us.
So I see a question about whether or not we need a physical before the vaccine. They do take a health history, very brief, just to make sure that they're vaccinating the right population at the right time, but there is no physical that's necessary. And I will also see that, this is an interesting question. How will it be determined how long the vaccine will last? Will people have to get sick? So this seems like sort of an easy way to do it. They just wait until people are sick again and they say, it wore off. But in actuality, there's a better way than that. So we are now beginning what we call phase 4 studies. And phase 4 studies are what are called aftermarket studies. And these are things where they're going to be looking at sort of the immunokinetics, which is the way the immunology builds in your system and then wanes and sort of decreases. And they'll be able to follow that and sort of eventually make a pretty good prediction about when we'll need a booster, if we'll need a booster. So it's a great question. All right. I think, and by the way, if there's more questions afterwards, we are very happy to answer. But I think we can move on to another question, which will be a polling question. So it's going to sound very similar to one that you've already been asked, but it's actually a little different. If able, would you get the vaccine today? Yes, no, unsure, but now there's one that says I'm even more likely. So where are you with this one? Good. There still are some people that are saying no, and that's okay. It looks like there's a lot less people saying unsure, which is nice. And hopefully a lot of you who are even more likely can help talk to your community, to your family, to your neighbors, and we can all sort of move forward together. And for those of you that are really still unsure or are saying no, we're happy to continue the discussion. So I want to thank everybody for attending today, especially because it was an evening. So I hope we were able to give you needed information to make your decision and make it clear enough that you can also pass it along to your families and people in your work life and people who may be more hesitant than yourselves. So I would absolutely like to thank Dr. Prajapati and Dr. Slakoper for taking time out of their evening for joining us and for giving us so much good information. And I'd also like to finish up by acknowledging that getting healthcare now, especially in the pandemic, is really challenging. All of our healthcare needs didn't go away because of the coronavirus. So if you, your family's on your plan, or even your coworkers that you know of, they need help and they're looking for a great relationship with their doctor, we are available at Our Health to help them as well. So thank you for your time tonight. I hope you learned a lot. I hope it was a little entertaining along the way, and hope to see you soon. Take care.
Bye-bye.
Bye, everybody. Thank you for joining.